Hey everyone! Welcome back to our channel. Have you ever heard that norovirus is only spread by food? Or that it only affects kids and the elderly? Today, we're uncovering the truth about norovirus, the so-called stomach bug that spikes every winter. Stick around to learn myths you may believe and facts that could keep you healthy. Myth 1. Norovirus only spreads through food. You've probably heard that norovirus is spread mainly through food. But while it's true that norovirus can contaminate food, this isn't the only way it spreads. In fact, norovirus is highly contagious and spreads through person-to-person contact, contaminated surfaces, and even through tiny droplets in the air. Norovirus spreads through any surface an infected person touches. Food is a common source, but public spaces like schools, restaurants, and healthcare settings are equally vulnerable. Myth 2. It's just a stomach bug. It's easy to think of norovirus as just a simple stomach bug. But did you know it's one of the leading causes of severe gastroenteritis worldwide? Norovirus symptoms can be intense, especially for young kids, the elderly, and people with weakened immune systems. It leads to dehydration, which can sometimes require medical intervention. Norovirus causes nearly 700 million infections each year worldwide. It accounts for about 20% of all gastroenteritis cases globally. Myth number 3. You're safe once you've had it. Many think that catching norovirus gives them immunity. Unfortunately, unlike some viruses, norovirus has multiple strains, meaning you can catch it more than once, even within the same season. Immunity to one strain won't protect you from another, so practicing hygiene is essential even after recovering from an infection. Norovirus immunity is short-lived and strain-specific. Washing hands is the best defense. Fact number 1. Hand sanitizers won't kill norovirus. Here's a surprising fact. Many people think hand sanitizer is enough to keep norovirus at bay. But norovirus particles are tough and aren't easily killed by alcohol-based sanitizers. That's why experts recommend washing hands with soap and water, especially after using the restroom or before eating. Hand washing with soap and water for at least 20 seconds is effective against norovirus. Hand sanitizers may not eliminate all norovirus particles. Myth number 4. Norovirus only hits in winter. It's true that norovirus cases surge in winter, but the virus doesn't just vanish in other seasons. Norovirus outbreaks happen year-round. It's just that colder months make it easier for people to gather indoors, where viruses spread more easily. Outbreaks can happen anytime, especially in enclosed spaces like cruise ships, dorms, and hospitals. Practicing hygiene year-round is crucial. Myth number 5. Bleach isn't necessary. Some cleaning products claim to kill most germs, but norovirus is resilient. Regular disinfectants won't always do the job. To be safe, bleach-based solutions or specific disinfectants rated for norovirus are recommended. This is especially important in homes with someone who's sick or has recently recovered. A bleach solution with a ratio of 5 to 25 tablespoons per gallon of water is ideal. Surfaces should be cleaned multiple times, especially high-contact areas. Myth number 6. Norovirus is only a kid's disease. Though children and the elderly are more vulnerable to the severe effects, anyone can catch norovirus. Adults often overlook it as something that only affects kids, but norovirus doesn't discriminate by age. It's contagious across all age groups and can hit healthy adults just as hard. Fact number 2. Norovirus can survive on surfaces for weeks. Here's a scary fact. Norovirus can linger on surfaces for up to 2 weeks if left uncleaned. This is why regular disinfecting, especially in shared spaces, is crucial to preventing outbreaks. Myth number 7. If you don't feel sick, you're not contagious. Norovirus can actually be contagious before and even after symptoms disappear. People may start shedding the virus just before symptoms appear and continue to be contagious for a few days after they feel better. It's a good idea to wait 48 hours after symptoms end before resuming regular activities. So, Now that you know the myths and facts about norovirus, how are you planning to protect yourself this season? Drop a comment below on any myths you might have believed. And remember, keeping your hands clean and surfaces disinfected is your best defense. Subscribe for more health insights and stay safe out there.